All right, we're live. I apologize for those following at home for the view. We try to make it as pretty as possible. So today's fictional case will be that of Nina Sayer. So this is a discussion of Black Swan. Any observations? Please feel free to keep it as unscientific as you could. What did you say? Yeah, this is similar to asking someone how they feel, right? What did you say?
I guess it made me uncomfortable that she was like a grown woman in a child's bedroom. Like nothing had ever changed. So
you actually noticed the decor of her bedroom, mm-hmm. Yeah, and it was uneasy for you. Yeah. So I think we need to kind of tuck that away. That's actually a pretty keen and significant observation that Nina's bedroom would be something you'd expect from of a 6-year-old, maybe, mm-hmm. Right? So there's a lot there to unwrap. Right? Any other observations? Since if you observe Nina's bedroom, let's focus on the character Nina only at this time. So again, from her surroundings, her environment, aka bedroom, to her as a person. What else did you observe? That was it?
She was kind of like meek. Like, she kind of let her mother boss her around, even though she didn't agree with her. And it's kind of concerning because she's older and not 6 years old.
Yep. So meek, especially, not only her mother, but a lot of people, even her peer.
Yeah.
And her peers, plural. Certainly her instructor. There are definite scenes there, not only of emotional but physical, sexual abuse from her instructor, her immediate supervisor. I don't know what you call him, dance instructor. I have no idea. Do we see her interact with others kind of in the opposite role, where might be the only scene in which she actually does that, and what does that tell you?
She needs liquid courage.
Yeah. What is that? And what does that mean? Now we're not allowed to say that in neurobiology courses, but what it's exactly what's happening here. What is liquid courage? Don't tell me alcohol. I get that. What is that?
She's very anxious, and she needs something to make her more disinhibited.
Yep. So you use the big word there, anxious or anxiety. What did Freud say anxiety is? I was going to say, what is anxiety? But I think that would give you way too much leeway. What is Freud's interpretation of anxiety? Freud's interpretation of anxiety is defined through friction. Friction between two opposing forces. Like, think of them as equal and opposite. We have that component of our subconscious that stores our most primal drives and impulses. What did he call that? The id. Okay? And then we have the opposing part of our personality that stores our societal norms, usually imposed through our primary caregivers, our parents, or in Nina's case, her mom. What part of our personality did Freud label that? The superego. Two equal but opposite forces in our subconscious. That's friction, right? What we want to do, that little devil, like that's over our right side, and what we're allowed to do. That's that angel whispering in our opposite ear. And that friction is going to cause us to be anxious. How do we resolve that anxiety? I mean, all of us are dealing with this internal dynamic, all of us, including the three in this room. Yet, I don't see, I know you have, you're masked, but I don't see, and for those of you following at home, everybody's masked. I don't see any anxiety in anybody's eyes right now. How could that be? Did I just lie to you? The answer is no. So, why is that? It's because there's a third component of our own. It's the third component of our personality called the ego. And the ego's primary role is to alleviate that anxiety caused by the friction between our id and our superego. And as long as you have a functioning ego, as long as you have ego strength, your anxiety will be kept sub-threshold. But when that breaks down, the anxiety will peak, it'll hit a threshold, and you may even be diagnosed with an anxiety disorder. That's the psychodynamic interpretation of what's going on here. You know one thing that weakens the superego? Alcohol. So when Nina drinks and she's intoxicated, that superego, which we think is localized in the cerebral cortex, gets pickled with alcohol. And we say things that we ordinarily wouldn't say because the superego's on vacation during that period of intoxication. That's exactly what we see in this scene. We get a glimpse into what Nina really feels. She wants to tell off her mother. Right? And whatever she's saying, she wants action. She wishes that would happen. Right? If we poured a little bit more here, I mean, maybe greater amounts of alcohol or maybe even other drugs that would do the same thing, cannabis, etc., and we had a discussion, maybe even a psychiatric evaluation with Nina, might she tell us even more than we observe in her telling her mother? Any guesses? And there's no right answer here, but if we had Nina here and we doubled the dose of the alcohol, we doubled her blood alcohol content, what might we hear from her mouth? Thoughts?
She's had abuse from her mother, probably.
What's that?
She's had abuse from her mother.
She feels as though her mother abused her?
Mm-hmm.
Okay, what else? It's the morning after, and now we tell Nina, by the way, did you know what you said in our interview the previous day? Because Nina likely would have a blackout.
Mm-hmm.
What do you think would be part of that conversation?
Denial.
Well, yeah, she'll say no. But listen, like a good psychotherapist, we recorded it, so there's no question here. We're not lying to our patient.
It kind of happened in the movie.
What?
She kind of she dived into her sexual part that she kind of doesn't ever show when she's sober.
Mm-hmm. Mm-hmm. Yeah, exactly right. And I'm sure there's more to the story here, right? But and I think what we're talking about now is likely to be a treatment plan that perhaps a psychotherapist might put together if Nina were to come to clinical attention, right? The treatment would be whatever it is we're dealing with, and we haven't quite figured that out yet. But whatever it is, we know the treatment plan would be biopsychosocial because every treatment plan is biopsychosocial. And the quote-unquote psycho part of that would be some form of therapy, some form of psychotherapy. And that, as well as other thoughts and impulses, are likely to be addressed in those types of sessions. Good. All of that from the liquid courage. Yeah, I agree. Anything else? So we have her as meek, subservient, submissive. We have the observation of her bedroom. We have the bedroom scene. Anything else?
She's very much attached to the identity of being a ballerina. There's this, I remember a scene where the guy asked her, "Who are you?" And she just said she was a ballerina. He's like, "No, what's your name?" So she didn't identify with herself. She identified with being the dancer.
So that's interesting. Yeah, that's an interesting take. Absolutely. Yep. So what would Erik Erikson say here? Jumping from Freud to Erikson. I thought you were an MD. Identity versus role confusion is a stage in Erikson's psychosocial stage theory, published as the 8 stages of man. Okay? Identity versus role confusion happens to be the fifth stage of development. And we may have a young adult who right now might be fixated there. Right? Now, maybe not as severe or concerning if she perhaps were 55 or 60 to be fixated at this adolescent stage. But at that 5th adolescent stage of development, Nina might be struggling with her identity, and therefore there might be role confusion as part of her diagnosis. Even though that's not a diagnosis per se, it may be somehow folded into whatever diagnosis Nina Sayer has. Right? So jumping from Freudian's psychosexual stage theory over to Erik Erikson's psychosocial stage theory, specifically something about her adolescent development traumatized her to a point where she might be fixated because she doesn't know her identity. Now, we could say that about other people too. There are certain people with white coats when you ask them and they say, "I'm a doctor," and they forget I'm a father, or I'm a wife. It's not necessarily pathological, but in the context of other things we're picking up on, we wouldn't dismiss it either. Good. Other observations?
She has that sort of obsession with that other, Mila Kunis's Lily.
Yeah, right. Yeah. And with regard to identity versus role confusion, that certainly is attached to that, but it's also then attached to the next stage, which is more congruent with her chronological age, which is the stage after identity, which is intimacy, right? Intimacy versus isolation. And she feels isolated, right? And that one's more congruent with her current age, right? That's what young adults struggle with, per Erik Erikson, right? That degree of intimacy. So a combination of isolation and role confusion when you now look at her relationship or current relationship with Lily. Mm-hmm. Good. Anything else?
I think the obsession with Lily comes from envy or wanting to be like her.
I need to know more.
I mean that in the sense that if she was more like Lily, then the instructor, Toma, would accept her more.
Yeah. I mean, he says it. I mean, he verbalizes it that you are perfection. You are the white swan. What I need from you is the black swan. And that's where Lily's character comes in. And many have actually rendered the opinion that Lily doesn't even exist. That it's more of something that is a goal externalized for Nina. And I just throw that out there as something that I've read, not necessarily agree with. But what I do agree with is that, as her instructor has told her, there's no problem with that perfectionism, right? She has qualities of the obsessive-compulsive personality and therefore the white swan. What he needs to see is more of the black swan. And that's where her friendship with Lily and her peer relation with this particular character, I think, evolves. And her trying to achieve, quote-unquote, the black swan. And what is that? It's nothing more than delving into her id, right? And we see a glimpse of the black swan when she's drunk, right? Where she's allowed to get that superego, that white swan part of her, on vacation, allowing the black swan to actually emerge. That's the id. Good. What else?
There was a lot of self-harm, binging, scratching.
Mm-hmm. So binging. There's definite evidence here of binge eating and purging behavior. We don't see the binge eating per se, but we see the scene where she's purging. So I think it's very reasonable to assume that there is binge eating and purging behavior, which allows us to discuss the eating disorders and that Lily might be afflicted with an eating disorder. I think for test-taking purposes, that includes the boards, binge eating and purging doesn't differentiate between anorexia and or bulimia nervosa. That is, both of those eating disorders contain binge eating and purging as part of their presentation. So no help there in terms of what would be the single best answer. That said, when a person like Lily presents to you, perhaps after that scene in the stall where she sees that word written on that mirror, maybe she gets anxious, maybe she comes to your clinical attention, and as part of the HPI, you hear that she had been purging. What additional questions do you want to know to help tease out anorexia from bulimia nervosa? Single question to ask is whether or not there is a fear of gaining weight despite being underweight. Because if the answer is yes, that is, we have a patient who is underweight, and Nina is underweight, and there's a fear of gaining weight, that is anorexia. That is not defining of bulimia. And that's where you start. Bulimia nervosa is defined strictly through behavior. That is, there's binge eating and purging episodes, and there's some quantification there, 2 to 3 times a week over 2 to 3 weeks, etc. That is not the case for anorexia. Anorexia is defined through a thought, not a behavior, and it's the thought, specifically a fear, of gaining weight despite being underweight. And that readily differentiates anorexia from bulimia. Now, and in this case, Lily rules in for anorexia nervosa. Now, she demonstrates binge eating and purging subtype. That's that bathroom scene. But she also demonstrates the other subtype, which is restricting subtype.
The scene with the cake.
Yeah, exactly right. So there's 2 discrete scenes that demonstrate both subtypes of this condition we call anorexia nervosa. So what is she? And I'll give you a hint. You can't say both. When both, the single best answer is binge eating and purging subtype. That takes precedent. And that's important because medications like the SSRIs have been shown some degree of efficacy in that subtype. There's something about binge eating and purging behavior that is amenable to the SSRI therapies. That is not the case for restricting subtype. So if your patient has anorexia nervosa, binge eating and purging subtype, or bulimia nervosa, SSRIs will be included in the bio part of your biopsychosocial treatment plan. And that would help Lily here. All right, so good observation. Binge eating, or I should say purging behavior, but binge eating and purging behavior, because we assume, I think it's very reasonable to assume that there was binge eating that preceded that bathroom stall scene. You also talked about harmful behavior. I need to know more. And let's not talk about the final scene just yet. So, prior to the final scene, do we ever see Nina attempt suicide?
It was the bathtub scene.
Yeah.
The bathtub scene. What happens?
She sees something and then she goes in the water or something like that. I don't know. She hallucinates something and is in the water.
We think it was a suicide attempt?
Not really.
Never. So there's another entity referred to as non-suicidal self-harm. And that's a little bit more complicated, at least in terms of acuity of care. If someone comes in with harmful behavior that is deemed a suicide attempt, intervention is straightforward. It's safety first. But for non-suicidal self-harm, it's a little bit more complicated. So what might be some reasons why Nina behaves the way she does? And by the way, there is evidence, again, collateral information from her mother. You're cutting again. So it's not only that bathroom scene, right? There's additional information. Why is she cutting? Why is she engaging in self-harm? Non-suicidal injury.
A sense of control. over herself.
Yeah, right. Sense of control. Yeah. Which itself would fold into anorexia nervosa, that sense of control, taking control, whether you're manipulating calories or whether you're engaging in cutting. The other reason why people may cut, and this is something to ask, is that it undoes that numbing feeling that they may be experiencing. So sometimes, maybe because of a visual or auditory cue, people feel numb. And one way to root yourself is to cut. It brings you out of that numbed state. So it's a maladaptive way, of course, but it is a mechanism to stop that numbing feeling. Why would Nina feel numb? Why would she have these episodes of feeling numb? If someone came to you and said, or someone came to you and you found out that they were cutting, and you asked, you inquired, and they said, well, it's because I have these episodes where I go numb. I just can't feel. And this really helps me to get through those. What's your line of questioning now?
I would want to know more in the sense of, like, are they dissociating? Is that what they mean by numb?
Yeah. And they're going to say yes.
Yeah.
Nina's going to say yes. I want to know more now. What are some other questions you want addressed here? Why would somebody like Nina tell you that she's having these periods of dissociation?
Could be due to trauma.
Yeah, that's where you have to go with this. So what happens is that if an individual who is younger and looking at Nina's room, maybe around 6, were traumatized, their hypothalamus is going to kick in, right? Fight or flight. But what happens if neither are options? She's only 6. Well, there's a third option called freeze, right? That's the 3 functions. They are the 3 functions of the hypothalamus. Fight, flight, freeze. That's dissociation. And there's evidence that exactly happened because of what we see as part of Nina's adult behavior. It's very reasonable to not only assume, but to inquire about that episode where she dissociated. Now, the dissociation, her changing her state of mind, her altered mental status, aka dissociation, could have been adaptive and even life-saving when she was 6. However, after the event, after the trauma, what was once adaptive can actually become maladaptive later on. So much so that as an adult, it could become the focus of clinical attention and be part of a larger syndrome such as post-traumatic stress disorder, such as eating disorder. So that's definitely a question, and I think that if we asked, there is more than enough evidence that there was a history of childhood sexual trauma. Which makes sense because there's something that is not in this movie that supports that.
A dad.
Okay. Most people who watch this film don't think much that this is a single-parent family. But we are not most people, right? This is a pertinent negative. There's a reason why Aronofsky doesn't write the father into this script. And it has everything to do with Nina's numbing, Nina's cutting, and other aspects of what looks to be PTSD in a dissociative spectrum. There's other scenes where she dissociates in the mirror, and then even at the end, where she, quote-unquote, does become the Black Swan. So you even have to think of maybe even a dissociative identity as part of this movie, too. Again, a question a clinician would need to inquire about. Other observations? So what I want you to know is this. If Nina were to present to you with whatever complaint, whatever her chief complaint, would it be really outside of the realm of possibility where she would endorse feeling not quite right, that there's something off, doc, that I just don't feel that I'm myself or have control over things that I do. Might we actually hear Nina say that? Because what that's describing is depersonalization. Similarly, Nina is likely to tell us, too, that her immediate surroundings don't always feel real, that there's some unreal aspect about them. And we know that because we see that happen, right? That's called derealization. And if either of those were present and clinically significant, and oh, by the way, they are, the diagnosis of depersonalization, derealization disorder would have to be entertained. If, because of her history of trauma, there were even signs of more severe pathology, what else would we inquire about at this point where we think there is evidence of depersonalization and derealization? And by the way, again, you only need one or the other, not both, to make the diagnosis. If there was a more severe form of this, what form might it take? The answer is dissociative amnesia. Okay. Not only do they feel that either they or their surroundings are not real, but there are actual gaps in memory that would be greater than expected from normal forgetfulness. Do you think Nina would actually endorse that? Do we see any evidence of that in this film? You think so?
When she thinks Lily came over, or is that just a hallucination?
Yeah, we don't know. Yeah, so there might be evidence when she actually thinks Lily did come over when, in fact, in reality, she did not. Now, if it were an even more severe form than that, how might that present? And the answer is, as seemingly purposeful wandering away from her home or work, and perhaps even assuming a new identity. That's called a fugue state. And dissociative amnesia may be with or without fugue. We really don't see evidence of this. Right? There's really no evidence of that. However, next question, if there were even a more severe form than that, how might it present? And the answer is as a distinct personality state that takes over Lily's conscious awareness. Because then the diagnosis would be dissociative identity disorder, or DID, formerly known as multiple personality disorder. And depending on how you interpret that final scene, there might be evidence of that. Right, so this film, Black Swan, allows us to review the different levels of severity of dissociation, which manifest as different disorders if clinically significant. All of them are clinically significant, one more severe than the other. Okay, depersonalization, derealization disorder, dissociative amnesia with fugue, and then DID. Again, on a test, or even in clinical practice, DID takes precedent. If there's a distinct personality state that takes over Lily's conscious awareness, it doesn't matter if she wanders from her home or work. It doesn't matter if she has depersonalization and derealization. DID explains all of the above. If not that, then dissociative amnesia. And if not that, then depersonalization, derealization disorder. And in closing, any of the above only when what we're observing and therefore describing is not due to the direct and physiologic effect of a substance or a known medical condition. Right? Those two organic pathologies or organic etiologies must always be investigated and ruled out before we diagnose any mental disorder. Any final thoughts on Black Swan?
I just kept thinking about how she lives in her mother's shadow. It seems like her mother never achieved her dreams. She kind of blames Nina for not being able to achieve her dreams. And she's really putting a lot of pressure on Nina to be the best.
And She says as much. I mean, she was part of the troupe when she became pregnant, and you can't be pregnant and be a ballerina.
Mm-hmm.
And she chose to keep Nina, and because of that, ended her career. And now she's letting her daughter know. And she's lived vicariously through Nina. Anything Nina achieves, she feels as though her choice is validated. So I don't think there's any medication to help her here. But again, psychotherapy to work through that, because she clearly is holding on to it. And unfortunately, is not only, I think, demonstrating clinical significance for herself, but others as well. That is also impacting Nina as well. I mean, if I were to start, I would definitely, I mean, in terms of any kind of evaluation, my thought would be primarily to look into a mood depressive or even anxiety disorder in Nina's mom, if there were to be something there. Given, again, all she believes that she gave up to be in her current situation. And listen, if Nina moves away and if Nina becomes autonomous and her own person, then all is lost. This mom does not actually view that or define that as a success of hers. It's only a success if she can take part in Nina's vocational success. That's what she's defining as her own legacy. At her age, just we'll kind of end things where we started things. This is the Ericksonian stage of generativity, achievement. And if not, then stagnation. And Nina's mom is stagnated, a.k.a. the midlife crisis. You're not going to find that in a test. Stagnation is the clinical term. Good. All right. Next up. What's our other film? Angel Heart. So this is our, and my main reason for assigning Angel Heart to be discussed today is that we could also discuss it on Monday as part of our undergraduate Q&A on Valentine's Day. All right, so set to Valentine's Day. Thoughts, observations about Angel Heart?
Felt confused.
Confused, yes.
A lot of the
yes.
time.
Yeah. So this is one. I mean, there are several movies that certainly capture this trope. Some better than others, of course, but this might be in the top 10 of just being totally confused through an entire film, and then having the ending allow you to look back on your last hour and 29 minutes and realizing, oh, okay, that's what it meant. All right. So if you can put up with it for the first 99% of the film, the final 10 minutes allows you to maybe have a grade of F go to whatever, a B or an A, depending on how much you really like the film. By the way, small tangent. Any other films kind of fit that mold?
That movie, like Babadook. Have you ever watched that?
Mm-hmm.
That was the terrible movie until the end, when you actually understand what it meant.
Okay, I'll buy it. I'll buy it.
Thinking like Get Out.
Get Out. Yeah, I can see that.
That's a good one.
Yeah, I can see that. The one, my favorite is I'm Thinking of Ending Things.
Oh.
That movie is so confusing that there's almost like two factions. One that turned it off and therefore doesn't know the end. And those that have stuck with it see the end and are like, that was awesome. Right? But it is so confusing that a significant number of people don't get there.
Sixth Sense, but I think it was good throughout. And
Yes, that one's good throughout. Yeah.
But
So anyway,
that one was kind of confusing a little.
yeah,
throughout.
I can see that. But again, it's if you come up with any more examples or thoughts, let me know. I'm really interested to hear your thoughts on that. But I'm Thinking of Ending Things as the lead for me, because I'm telling you, depending on who you talk to.
I think I started this one. It's on Netflix. I don't think I ever finished
Exactly,
it.
that's what most people say. But trust me, if you push through, and if you watch the end, you'd be like, Psycho?
Yeah.
Yeah. I mean, it's a surprise ending, but I think the movie was good. I mean, remember, arguably the most infamous scene in film history takes place in the beginning of that movie. There's stuff in the beginning of that movie, right? That shower scene is really in the beginning, which itself was kind of iconic because scenes like that are usually left to the end.
Oh, another movie is like The Boy. I don't know if you ever watched that.
I've heard about that. I have. That's been recommended. I have not gotten around to watch that yet.
The ending makes it worse, but it's good.
Yeah, but I definitely heard that before. All right, well, back to Angel Heart. So you were confused. That's fair. So, all right, what do we want to talk about?
About Harold, or what's
Harry?
his name? Harry, yeah.
Mm-hmm. So thoughts?
He was very committed to this case.
Oh yeah, no doubt about it. And again, we might not know. I mean, he does seem like he might need work. So I mean, but boy, do we find out why? We find out why at the end. There's something subconsciously that is driving him and motivating him to solve this case, and nice twist at the end as to what that might be. All right. So subconscious motivation, sure. I agree. Anything else?
And he's also like experiencing amnesia.
Yeah, I mean, that's the twist at the end, is that this is someone who's clearly experiencing amnesia. And I think that if you asked Harry, he would endorse feelings of depersonalization and derealization too. And if we're going to think that this might be dissociative amnesia, or just amnesia in general, then we can safely say that feelings of depersonalization and derealization are part of that larger disorder. So he's not likely to be diagnosed with depersonalization, derealization disorder. Those types of feelings and experiences are really wrapped up in the amnesia, right? So that's where we start. Now, remember, if somebody presents to you with a loss of memory that you believe, in your medical opinion, cannot be attributed to age-related forgetfulness, which is true here. What are the two things you have to think of? We'll say that they're 1A and 1B. Yeah, right. General medical condition, and what else?
Yeah.
Always. Often referred to as organic pathologies. Always, right? Psychiatrists cannot begin to practice psychiatry unless they recognize and rule out that whatever the behavior is, whatever it is not attributable to an organic pathology, right? Medical condition and or the direct and physiologic effects of a substance. Is Harry using?
He loved his cigarettes.
Possibly cigarettes. Cigarettes cannot induce dissociation.
I'm just trying to think.
So even if he uses, and he smokes excessively, but and we would put this in the treatment plan. We need him to cut down and quit. But having said that, even though we're going to diagnose tobacco use disorder in this character, it's not going to explain his amnesia.
If we're talking amnesia, then either benzos or alcohol.
You think he drinks excessively or uses sedatives? Well, let's put it this way. I want to rephrase the question. Is there anything explicit in the script? If you actually searched scripts.com and you brought up the script for Angel Heart, don't do it. And if you search, I'm not going to ask you to nerd out in front of me. Although if you did, I'd be proud. If you actually search the script, would substances actually be written in the script for Harry? No.
Yeah,
No.
I don't recall.
So the provisional answer looks like it's no. However, we have to quickly follow up with the second question is, does the absence of that in the script reassure you as a clinician that substances aren't playing a major role in Harry's behavior? Does the absence of a substance in the script reassure you as a clinician that substances are not playing a central role in Harry's behavior? And the answer should be no, because we should always, as clinicians, maintain a high clinical index of suspicion. Right? So we're going to leave a substance-induced disorder, and the way the current DSM states this, a substance-induced psychotic disorder, even though we know this is association, the current revision of the DSM-5, merges dissociative states with psychotic states when related to substances. So now it's called a substance-induced psychotic disorder. We're going to leave it in our differential, but it'll be lower. Similarly, is there any evidence in that script that Harry has a medical condition?
I'd say no.
I thought there is. I thought he actually suffered TBI, didn't he? Or maybe I read into that.
What they said about Johnny is that he was in a coma.
Right. Okay. So yes.
Yeah. So there is, right? Yeah, there is. So now we have to seriously consider this, because this might be amnesia due to anoxic brain damage or whatever put him in that coma, right? So that is going to be coded on that. Well, what used to be Axis 3, right? As part of his past medical history. Good. All right. What else about Harry/Johnny beyond this differential?
I mean, he starts off like very put together and like rational, and slowly becomes unhinged.
Yeah, and again, I think the twist at the end maybe provides some information about that. Again, he seems like he's very assured of himself, but as his subconscious slowly becomes conscious, we could see that begin to unravel. Right, and again, at the end, we know why. I think there might be some teachings here about the Oedipal complex. Right. So what's the Oedipal complex? I'm using these big words again.
So, the story's like the Oedipus, had sex with his mother. So it's like interfamily relations.
Mm-hmm. Mm-hmm. For Freud's theory, specifically his psychosexual stage theory, first stage, birth to 1 year of age, the oral stage, 1 to 2 would be the anal stage. And then from 2 to 5, you have the phallic stage. And the hallmark, the milestone of the phallic stage is the resolution of the Oedipal complex. Right? So this is where the child begins to recognize that they are different from the opposite sex parent. And that appreciation of that sex difference begins to impact personality development. This was termed the Oedipal complex, named after the Greek tragedy, where Oedipus Rex it tries to escape his fate. Right, the oracle tries to escape his fate, but ultimately does return to Thebes. I'm not sure where he's from, and does actually sleep with Jocasta, his mother. So to that extent, perhaps superficially, we see that play out. Now, if Harry / forgetting all these names, Johnny sleeps with his daughter, and there is an allusion to the Oedipal complex, maybe that's the writer-director throwing us a hint that there is something going on with regard to this particular individual's psychosexual development that perhaps would be a hint into his mental disorder. So again, as a therapist, I think that's something you to consider if we're going to take the way this film is written, the actual script of this film, screenplay, as a hint as to what is really going on in this character. Any other thoughts about Harry? What happens at the end? Again, I didn't see the end. So explain to me what you saw specifically about Harry's character and how this all ends for him.
He kind of remembers or
all these things that he may have repressed are now surfacing.
How do they surface? How does he recall who he is and what he did? Did somebody count back from 5 and snap their fingers? It was the series of events that led him up to it, right? They somehow cued his past memories. If the etiology of this character's amnesia were organic, was due to brain anoxia from that coma, that is really unlikely. What type of amnesia is more likely to respond to those types of cues? Dissociative amnesia.
Okay.
Right. So even though when a psychiatrist is evaluating for dissociative amnesia, they really do have to keep organic etiology at the top of the differential. In a film that actually has written in the script an organic cause, a physical cause, for why Harry doesn't remember that he's Johnny. In the end, the way the script is written and the information we get, this actually turns out to be dissociative amnesia anyhow. But it's an interesting kind of twist to this movie. Now, again, I think most normal people watch this movie and realize the twist is that, oh, wow, he happens to be Johnny and Lucifer is actually Lucifer. But there's another layer to that twist, and that is his amnesia is not due to brain trauma or anoxia. It is actually dissociative amnesia, even though we will admit that should be lower in a differential, at least at the start of this film. That's the real twist of this movie. I mean, if you try to publish that, it's not going to get published, but it is true. Any other thoughts about Harry / Johnny? Any other characters from Angel Heart you want to discuss? This film, especially watched back to back with Black Swan, again reinforces dissociative disorders. Now, unlike Black Swan, which is eating disorder, this one is, I think, more straightforward. Right? This one is much more straightforward.
Epiphany's character was interesting.
What did you observe? We have about 5 minutes left.
Yeah.
What did you observe in Epiphany?
Just like thinking that back to that scene where she's like in that ritual. And that scene is what I remember.
Yep. So yeah, this is a perfect way to end this too.
Yeah.
It's really as a segue to next week. That scene and that ritual is part of a religion, right? It's a religious rite, and that religion is called voodoo. There's another practice in the same region that is often mistaken for voodoo, and whoever is to blame didn't help the situation by actually labeling that or naming that hoodoo with an H. All right, so I want to leave it there because psychiatrists should not be rendering opinion on a religion, any religion. And that's exactly what that scene actually demonstrates, that scene with Epiphany. However, there is, again, another syndrome, hoodoo, that is often confused with the religion. And we're going to actually talk about this in more detail next week. I think the Twitter group already posted. It's going to be a case discussion of the skeleton key, as well as the skeleton key will be the abnormal activity film discussion. And we're going to pair that with The Green Mile from Stephen King. All right. We'll see everybody back next week. Thank you.